So in lung cancer, if you say in the first, second, or third stages, when the cancer is localized to the lung and adjacent part, it has not spread beyond that. Then radiation therapy, chemotherapy, and surgery. These are the option. You can go ahead with surgery and then radiation and chemotherapy, or you can go ahead with chemo and radiation and then you can get a surgery done. But in the fourth stages, if you especially talk about fourth stages and mainly in the adenocarcinoma, then the targeted therapy is very important, because in adenocarcinoma there are mutations at the gene level which can, and there are drugs which can actually target that mutations. So we go ahead with biopsy and then we test like EGFR, we test ALK, RAS1 and PD-L1, and we have special drugs against them. And if you see from 30-40 years back, the median survival with a metastatic lung cancer, means the lung cancer and it has spread, it was only 8 months. But in the current area, if proper mutation has been detected and the patient is able to get the proper treatment, then the median overall survival has increased from 8 months up to 36 months. More than 4-fold it has increased. People are living more, and the toxicity profile, the main toxicity profile of the immunotherapy or targeted therapy compared with conventional chemotherapy are very less. So what happens is that the patient takes the chemotherapy and he develops fever, cough, diarrhea, vomiting, decreased blood counts, repeated hospital admission. These all are required. But for the immunotherapy and targeted therapy, the side effects are very less, because they are targeted. They will target the special cells only that have those mutations, the cancer cells. The effect on the general body cells, they are a little less as compared to chemotherapy.
Right.
So the more role of immunotherapy and targeted therapy in lung cancer is especially in fourth stages, where the conventional treatment like surgery, chemotherapy and radiation therapy, they don't properly work, or they don't give that expected outcome.
What about prostate cancer, doctor?
See, so in the current scenario, as if I say, the main treatment for prostate cancer in the initial stages, it can be either surgery or radiotherapy, or you can say you can just put a patient on observation. Okay, just we'll follow that patient. Will not give any in very early stages. He will just follow this patient, and if he will develop symptoms or he'll have problems, then we'll treat. But in advanced cases, in localized prostate cancer, it can be surgery followed by radiotherapy, or it can be radiotherapy along with hormonal therapy. So mostly it is hormonal therapy that are used in the treatment of prostate cancer.